In many cases, medical tests have saved lives by catching a tumor or an aneurysm just in time. But we're now learning that in some cases, medical tests can actually do more harm than good. Here to reveal some of those that you may want to think twice about taking is Dr. Devi from the NYU School of Medicine. Good morning to you.
Good morning.
First up, we have CT scans. Kids fall down and bump their heads all the time, but having too many of those CT scans, you say, can hurt their brain development?
Yeah, so that's the main risk with CT scans. So for adults, when we fall, when we get injured, our first reaction is to go to the ER and get a CT scan of the brain to make sure there's no bleeding. That's okay for us, but for kids, the CT scan has a lot of radiation and it can damage kids' brain development. So that's what we're worried about. Especially in kids, since they have so many falls, you worry about it. They get a lot of minor injuries and stuff. So you really want to look at whether they're having symptoms. So if they're having a lot of changes in terms of their behavior, if they're confused, if they have bleeding, if they lose consciousness, then that might be a reason to get checked out. But otherwise, you don't want to automatically jump to getting a CT scan.
Okay, another one of these tests that may be unnecessary is genetic testing, which is becoming more readily available, but you say it can cause anxiety.
Well, yeah, so it's more the fact that if you're looking for something specific, that's the thing with any of these tests. If you're looking for something in particular, then it's great to get the test and get more information. But if you're not sure what you're looking for, it can cause problems. So let's say that you get all this information about what your own genes are. It can tell you what you're predisposed to get in terms of medical diseases, but it doesn't tell you what you actually have. So in terms of the anxiety, you're sitting there always wondering, will I develop this disease or not? That's a heavy burden to carry for your entire life, right? Because the genes aren't the things that are causing you to develop the disease. It's genes plus your environment.
Yeah, it can be helpful to know what to look out for, but at the same time, having that hang over your head can be debilitating for some folks.
And for your family, too, because if you find out what your genes are, then your family members probably are at risk to develop the same things, and they may not be ready to hear all of this stuff.
Okay.
So that's...
Next up, we have the MRI of the spine, and doing that too often could be unnecessarily because we're going to see wear and tear no matter what, you say?
Yeah, so this is what I see the most often. I'm a pain management specialist. Now, low back pain is so common, so I think if people have low back pain for a certain amount of time, let's say 6 months, or it's not getting better, it is important to get checked out, and an MRI might be useful. But one of the risks that we see is that people get MRIs repeatedly, and they're looking for things to get better, to go backwards. But a lot of the changes that happen on an MRI are related to age. So you see wear and tear on the discs, you see wear and tear on the joints, arthritis. It might not get better. So the danger is to try to correct it.
And then just in general, tests on the elderly may cause more pain and discomfort than it's worth.
True. It depends how healthy they are. So we look more, not necessarily at age, but life expectancy. If someone is dying of something, not necessarily because they're elderly, but if they are extremely old, that might be a risk. If someone is dying, then you don't want to order a lot of preventative scans and things that could cause them a lot of discomfort and might not be as helpful.
Dr. Devi, thanks for looking out for us. We appreciate it.
Thanks so much. Thank you.
Yeah. 27 minutes after the hour, and coming up on Fox and Friends, Paula Deen planning a comeback.